It gives me great pleasure and honor to ask again Professor Harvey Feinberg to summarize our very interesting and stimulating and challenging morning. Harvey.
Thank you very, very much. It's evident that prevention means many things, calls upon many resources, and demands attention from many quarters. Prevention is paradoxical because we know it's a good thing culturally, historically, personally, and yet we also know we underinvest as a society and we don't adopt always healthy practice individually. How do we reconcile these two sides? In two ways. First, through increasing emphasis on the right kind of evidence about what works and what does not work, how to design the most effective interventions, how to tell the difference between what's really cost-effective and what's merely theoretically attractive. The work that we have heard about from both Professors Sommer and Duflo illustrate beautifully these examples. The work on infectious diseases that Professor Cohen illustrated so importantly that we not underestimate the importance of achievable gains on preventable, communicable disease, still waiting action. So understanding is one side of dealing with the paradox, but the other side was illustrated so beautifully in Professor Gamzu's presentation, which is we need leadership, initiative, and follow-through. And we need to do it in a way that is persistent. The problems did not develop overnight. They cannot be solved overnight. The opportunities require long-term attention, which is part of the reason they are difficult, but also an important part of the reason they are so important. I could not help but think of Moliere's famous character who described his astonishment when he learned he had been speaking prose all of his life, when Esther was describing how surprised she was as an economist to be recognized for work in preventive medicine. And yet, as Professor Gamzu's talk so brilliantly illustrated, health is in all policies. Health approaches everyone's attention, and health requires the combination not merely of the professionals within healthcare, but also the urban planners, also those who are educators, also those who are behavioral scientists, and yes, also those who are economists. Because it's only by combining forces that we have a chance to achieve the goal. And the goal, I would submit, is not merely a set of changes individually, not merely a set of policies that need to be advocated, adopted, and implemented, but it's really to build over time a culture of health. It is idea of a culture of health that makes all of these choices a matter of natural preference, not a matter of forced choice. It makes us wake, live, and experience throughout the day an environment in which the healthy choice is the easy choice, it is the natural choice, it's the right choice. And I hope you feel as inspired as I by the set of presentations that we have heard that a healthy culture, a healthy society, a culture of health is truly within our reach. Thank you all so much for being here, and join me in thanking our four presenters for their wonderful presentations.
Thank you very much.
Pleasure.
It gives me great pleasure to thank Professor Duflo, Professor Sommer, Professor Feinberg, Professor Cohen, Professor Gamzu for the brilliant lectures, and to thank you people for joining us this morning in this exciting and stimulating event. So again, thank you, and I hope that from now on everybody will smoke less or not smoke at all, not do a lot of exercise, lose some weight. Thank you very much.